In its essence, the National Health Insurance is a commitment to eradicate the stark inequalities that have long determined who receives in our country, who receives adequate health care, and who suffers from neglect. By putting in place a system that ensures equal access to health care, regardless of a person's social and economic standing and circumstances, the NHI takes a bold step and a stride towards a society where no individual must bear an untenable financial burden while seeking medical attention. Now, this vision is not just about social justice, and this vision is not a new one, as you have heard, and I'll refer to it a little later. It is also about efficiency and quality. The provision of healthcare in this country is currently fragmented. It is unsuitable and it is wholly unacceptable. The public sector serves a large majority of the population but faces budget constraints. The private sector serves a fraction of society at a far and we as a country have made a global commitment that we are going to have universal health care. So those who are trying to hold us back to a fragmented system are completely out of line with the global vision that has been set, which we are a part of. Remembering that South Africa is part of the global community, so we are not mad, we are not outliers, we are very much in line with what is happening in the global community. The real challenge in implementing the NHI lies not global challenge which was brought about by COVID-19. We harped on the issue of solidarity. And we kept saying we want international solidarity so that those countries, particularly in the Northern Hemisphere, who have been able to have much better systems, aided and abetted by colonialism, the empowerment that they received from raping and pillaging the resources of countries that they have colonized, that they must pledge solidarity. And we did so when it came to vaccines, we did so when it came to PPEs, we did so also when we came to debt relief. And we said we need solidarity. And it was embraced to a large extent, even by those in the Northern Hemisphere. So this concept of solidarity proposes a comprehensive strategy that combines various financial resources, including both additional funding and reallocation of funds already in the health system, This approach ensures contributions from a broader spectrum of society, emphasizing the shared responsibility and mutual benefits envisioned by the NHI. I repeat, the shared responsibility that we all have as South Africans. Now, the financial hurdles facing the NHI can be navigated with careful planning, strategic resource allocation, and a steadfast commitment to achieving equity. And let me repeat, achieving equity. And I want to emphasize this point, that achieving equity is what the struggle against apartheid has been all about. And it continues to be about that we should have equality. Now we cannot have a situation where there is a portion of South African population that continues to live under an unequal system, while the others continue to live under a privileged type of system. This is completely against what the ethos of our democracy is. So for those who would like to see those privileges that we continue to enjoy continuing, sorry, you are on the wrong boat. The boat that we are on is about equality. Now, the NHI carries the potential to transform the healthcare landscape, making the dream of quality, accessible care a reality for all its citizens. Now, I will not go into the criticisms that have always been levied about this type of system we want to establish. The NHI fund will procure services from public and private providers to ensure all South Africans have access to quality health care. The NHI recognizes the respective strengths and the capabilities of the public and private care health systems. Now, quite often it is said that the private healthcare system is the real backbone of our health, and they have the best of everything. And they always try to downgrade the public health system, and in fact, in a very insulting way, they dismiss it completely. But let me tell you something, what we are trying to build is a Rolls-Royce system of healthcare for all South Africans. That is what we are trying to do. Now, it aims to ensure that we complement the systems and reinforce them with each other through more effective collaboration between the public and private sector. We can ensure that the Africans have, firstly, with the right to vote that all South Africans will have. A number of South Africans were terrified that all these many South Africans, largely black, would now have the right to vote. And they were so terrified. Some of them started collecting tin food, putting it in their cupboards, in the hundreds of tins and so forth, fearing that a calamity is about to descend on them. We all won the right to vote, and nothing happened. Only progress that started building our nation. And then I also spoke about the right to strike. And the employers were so terrified that these hordes of workers are now going to have the right to strike, and it's going to destroy the economy. Instead, having won the right to strike, we have been able to grow this economy almost threefold since the days of apartheid, showing that there was nothing to fear. They were just fearing ghosts. So now today I say, with the national health care, those who are fearful, those who are afraid, and I say, just think about the commitment that the governing party has always had to building South Africa as a sustainable, growing nation. And this is what nation building is all about. National health care on a universal basis is going to build our nation in a very practical way. Now, preparation for the implementation of NHI necessarily requires a focused drive to improve the quality of healthcare. We have already begun implementing a national quality improvement plan in public and private healthcare facilities, and we are now seeing vast improvement. And let me say, we are seeing vast improvement, even in areas where we never thought we would see improvement. In the deep rural areas of our country, we're really seeing great improvement of health facilities. Even in our townships, where even old people go and no longer need to queue up, for instance, for getting their critical care medication. They get it through computer calculations, and they just go and pick their medication up from cubicles. And that is what improvement of healthcare is all about. It's happening. It's happening in the township. I go to the deep rural areas in Limpopo, in KZN, in Northwest, and I go to hospitals right in the rural area. And I'm always amazed that they have the same machines, MRI machines, whatever they're called, right in rural areas. signing here, I hereby, in terms of Section 84.2, read with Section 79.1 of the Constitution of the Republic of South Africa,
able to
1996, assent to the National Health Insurance Act of 2023,
Yes, the Minister and the Deputy Minister and the MSS can remain in front for a picture. Thank you. You remain standing so that, thank you. Please. Photographers in front, please do not block the cameras at the back. Thank you. The team from the Department of Health is here. Can you please come forward and join the picture? Thank you. Okay, ladies and gentlemen, at the conclusion